My name's Iain Trayner. I've also got a tech project officer who's Liz Fowler. We typically research, source funding and roll out digital technologies to support patient care. The areas that we're working in at the moment are home monitoring, outpatient clinics, ambulatory monitoring, inpatient monitoring, integrated health and social care and some remote diagnostics. Some of the home monitoring work that we do, we use a system called Florence. Some of you will be familiar with it, some of you will not. It is a web-based clinical interface that collects data from patients from their own mobile phone. So there's no expensive equipment that we need to supply. The types of data that we're currently being monitored using Flow, blood pressure and weight, heart rate and blood oxygen, blood glucose, exercise tracking and weight, medication compliance, and also symptom management. So symptom management is probably one of the areas that's more appropriate for patients with MS. So Rachel asked us to help design some protocols for her patients that would help with monitoring relapse symptoms. It can be, as I understand it, I'm no clinician, but it can be very difficult for patients to recall when they had symptoms, especially if their appointments are 3 or 6 months apart. So this is the symptom tracking and relapse identification protocol that we have. It's a series of questions that the patient gets asked periodically. In this case, it's once a week. So they get asked, have you had any change in your symptoms in the last 7 days? Either yes or no. Depending on their response, they then get asked another question or given some information. And you can have as many layers as part of that protocol as you want. And obviously that culminates in them being told to text the symptoms into Rachel if they've had any. We also have protocols for regular blood checks. It can be difficult for people to remember to make appointments to have their bloods done so that they can then get the appropriate medication. So we have fortnightly, we have monthly reminders, 3 monthly and 6 monthly. The longer those the protocols are, the more messages they get. So the 6 monthly one, there's a 6 weekly message in there, just a wee reminder to say your appointment's due in 6 weeks or 2 months, whatever it happens to be. We've also got a protocol for pelvic floor exercises, which has been extremely successful, very annoying apparently. So from the clinician perspective, Flow looks like that. That's actually a blood pressure result, but you can see it's pretty simple. Nice lines, nice chart. The results down the bottom, there's nothing complicated about it. And what that means from an MS perspective is that when Rachel sits down with the patient, she can go through the history and she can see where there's been little blips, little peaks and troughs, and that means that they've had symptoms. Moving on to virtual clinics, we use a system called Attend Anywhere. That's the clinician dashboard. So again, pretty simple, nothing complicated. It's a virtual waiting room. So the clinician can see who's waiting, how long they've been waiting, whether they've been attended. And that's what the patient sees, except Rachel's face would be on there, but I didn't want to put that up. So the patient connects to the system. It's just a link in an email that Rachel sends, and the patient clicks the email and up they pop. It all happens as if by magic. So the benefits of the VC clinics: it provides equity of service, so it means people across the islands can access the service just the same. Location is of no consequence. The virtual drop-in clinic, Rachel runs a virtual clinic, I think it's once a month, and that gives dedicated time for people to access Rachel, so they know that she's available for that 2 or 3 hour period. Rachel makes herself available for that period, and they can just pop into that virtual clinic. Rachel's PC will make a little noise to say that someone's waiting in the virtual waiting room, and she can just have a chat with them. For some of the services that we've got, we are linking in with consultants on the mainland who use this service. We've actually got a respiratory consultant who is based in the south of England who is running virtual clinics for us, both in the hospital in the Western Isles and also accessing into people's own homes. We also supply some bespoke solutions in certain circumstances. So the beam robot driving around earlier on. Pretty handy bit of kit. We've got this installed in a patient's home at the moment. So you can dial in from anywhere as long as you've got internet access. You control the device, you drive it around, you control the volume and the speakers and everything remotely. The patient who has this device at the moment is a young girl, short-term memory loss and frequent falls. So previously the family members were having to check in very regularly throughout the day, having to leave work and come and check up and make sure things were okay. But now they can connect to that device using their mobile phone or their tablet, and they can drive around the house and make sure that everything's okay and have a chat. Some of the integrated health and social care monitoring that we're working on. This is a very much in development system. We've been asked to help out with some commercial partners. They wanted to use the Western Isles as a bit of a test bed. So we have various health monitors, blood pressure, blood glucose, all the usual stuff. But we've also combined that with next generation digital telecare devices. So things like motion sensors, temperature sensors, light sensors, smoke, flood sensors, and also door, window, chair, bed sensors, all that kind of stuff. So for the first time in Scotland, there's a one-stop shop. At the moment, you've either got telehealth or you have telecare. And they're both very, very different, and they're probably run by different parts of the organisation. So this combines all of that. So there's wireless data transfer. These devices are all Bluetooth, and there's nothing fancy about them. You can buy them on Amazon. They're not expensive. They're about the motion sensors that does temperature and light as well. So it's about 35 quid. So very accessible, easy to replace, easy to maintain. So wireless data transfer to an integrated monitoring hub. The information can go to relatives, can go to neighbours. We can route it anywhere we want. It can be text message, it can be email, it can be phone call. So it can go to relatives, neighbours, health professionals, third sector organisations, emergency services, housing partners, and also social care. So we have a local housing improvement team called TIG, and they're extremely keen on this type of system because it means that you can monitor the environmental conditions within someone's home to see if that is affecting their medical condition. From an MS perspective, you're able to monitor if someone's moving around during the night when they shouldn't be. Are they going out? Are they getting up and hoovering in the middle of the night? Whatever. So that's kind of what we do, and it's been a great pleasure to be able to help Rachel improve the service that she can provide. It's a difficult thing to do across all the islands, as I'm sure some of you know. So we feel very privileged to have been a part of it.